All right. Hello, everyone. Welcome to my presentation. Today, I am going to be talking about Bay Area Community Health, which is an agency located in the Bay Area, California. If you don't know where that is, it's Northern California, San Francisco area, if you've ever heard of it. My name is Tracy, and I will be giving this presentation. All right, so what is Bay Area Community Health? Like I said, it is an agency here in the Bay Area, and it provides health and social services for individuals and families and communities across the Bay Area, California. Some of the services that it provides is medical, dental, behavioral health, vision, specialty care, and support programs. As you can see, some of the specific needs that it provides are physical exams, acute specialized illness diagnosis and treatments, preventative care, dental exams, cleanings, fillings, behavioral health prevention plans, assessments, diagnoses, treatments, interventions, substance abuse services for vision, eye exams, eye disease screenings, but it also provides some specialty care such as acupuncture, chiropractic services, dermatology, podiatry, women's health, teen wellness, HIV programs, transvision, which is made up of the LGBTQIA plus community, street health programs. If you didn't know, there is a very high need risk of homeless population here in the Bay Area. The team is made up of doctors, nurse practitioners, physician assistants, and various other health specialties. They provide accessibility to healthcare both on weekdays and weekends, and these services go across all the Bay Area. Something else they do is they do mobile, so they can also come to you if you do not have access to travel to them, which is awesome. All right, as you can see here, I have a little chart. And why did I choose this? I chose this because I grew up in the Bay Area. I lived here for 18 years, moved away, and now I'm back living here, and just wanted to dive deep. I know that the Bay Area is a highly needed area for healthcare, and it's a highly diverse population. And I just wanted to dive in and learn about some of the agencies, specifically this one, and how it can help individuals a part of my community. As you can see here, California ranks very high in states with mental health high needs, as you can see in these charts. Specifically, teens are at risk for depression in the Bay Area, about 100,000 teenagers. This was in 2005, but all individuals with mental health issues is over 1 million. These numbers have only increased as mental health has become more important. Yeah, so this is why I kind of chose this, seeing these numbers and knowing that there needs to be more done in my community. So looking at this program and assessing it, some of the efforts that have been put into this program, like I said, health screenings, educational workshops, counseling sessions, and the program agency is made up of 600 plus staff members. And some of the outcomes that we have seen from this agency is overall improved health outcomes, increased access to healthcare, empowerment of the community, and identifying gaps that are needed in the community as well. This program has shown positive results. Like I said, health outcomes, access to healthcare, and many other things as well. Although many positive things have came out of it, we've also been able to find out what is still needed in the community as well. And the agency is continuing to try and find ways to shorten those gaps and provide more care to everybody. Continuing on that, some of the ways that we can assess the program is by getting community feedback, looking at the pre and post intervention assessments, looking at the numbers and how those numbers have improved or declined. Also reading client satisfaction surveys and stakeholder feedbacks as well. Not we, but the agency takes feedback very seriously to be able to make improvements, but also know what is going well in the agency and what patients are liking and disliking. The agency is able to review assessment numbers before and after the interventions to find out what interventions are working and what interventions are not working. And the agency also works with other community agencies to find out what's working and gets their feedback as well. And I just wanted to include a little story from one of the patients. This is from a 34-year-old single mom of 5. She said, raising 5 kids on my own has its own challenges. I'm so thankful and grateful for the Bay Area Community Health for being a beacon of health. With their help, I am able to finally feed my family. So that's a great accomplishment. Evaluating the program, like I mentioned, some of the surveys and feedback, looking at the theories and evidence-based interventions that are used. The social ecological model is used to examine dimensions of an individual's life and assess the degree of impact that different factors may be playing in their life. The health belief model is so that the agency is able to find out what the individual can comprehend about their health condition and find out what their perceptions are and what their influences are about their health conditions. As well as the community-based participatory approach. So this is used to get community feedback, like I stated earlier, in order to address community needs effectively. The agency also uses CBT and also other evidence-based interventions as well. Kind of just depends on what the therapist or clinician wants to use for their specific client. I wanted to touch on the diversity and culture of the agency. Here is a little chart about what culture the agency serves. You can see here that 29% of the population served was Asians, 10% of the patients served were white, 3% were African American, 1% were Hawaiian, 1% were American Indian, and that other 11% were people from other cultures. The Bay Area Community Health is also made up of 600 plus employees who come from very diverse backgrounds as well. So they're able to provide those culture tailored services to those patients that need it. And lastly, I wanted to touch on social work disposition 7. This really shows the importance of self-reflection and ongoing learning, as it's a very important component for cultural competence and ethical conduct in our field of social work. This disposition is committed to proving self-improvement, and it's very aligned with the ethical standards of social work, following the social work code of ethics, and just showing how social workers can be competent on cultural competence and being able to provide that cultural diversity care in the Bay Area, and understanding that culture is a very important part of the Bay Area. And those are my resources. Thank you so much for listening and have a great day.